Bladder cancer: the signs, symptoms, and treatments. Bladder cancer is among the top 10 most common cancer types in the world, but many people still miss the warning signs. It usually begins when abnormal cells inside the bladder start growing out of control. Over time, these cells can form a tumor. Common symptoms. The most common symptom of bladder cancer is blood in the urine. This is known as hematuria. Your urine may look pink, red, brown, or darker than usual. Sometimes the blood may appear once, go away, and then return later. When to seek medical advice? If you see blood in your urine or your urine looks discolored, make an appointment with your doctor. Blood in the urine does not always mean bladder cancer. It can happen because of infection, kidney stones, or other conditions, but it is important to find the cause as soon as possible. Advanced stages. If bladder cancer reaches an advanced stage and spreads, symptoms may include pelvic pain, back pain, and unintentional weight loss. Swollen, puffy, or heavy feet and legs can also be a sign of advanced bladder cancer. This can happen when fluid builds up in the body, a condition known as edema. Causes. Bladder cancer begins when cells in the bladder develop changes in their deoxyribonucleic acid. These changes can cause abnormal cells to grow out of control and form a tumor. Types of bladder cancer. There are different types of bladder cancer. The most common type is urothelial carcinoma, also known as transitional cell carcinoma. This type starts in the cells that line the inside of the bladder. Other types of bladder cancer. Other types include squamous cell carcinoma and adenocarcinoma, but these are less common. Several factors may increase the risk of bladder cancer. Smoking is one of the biggest risk factors because harmful chemicals from tobacco can collect in the urine and damage the bladder lining over time. Exposure to chemicals. Exposure to certain workplace chemicals can also increase risk. These chemicals may be found in industries such as textile, rubber, leather, dye, paint, and printing. Increasing age. Bladder cancer can happen at any age, but it is more common in older adults, especially people over 55. Gender. Men are more likely to develop bladder cancer than women. However, women may sometimes be diagnosed later, which can make the condition more serious by the time it is found. Race. Bladder cancer risk and survival can vary between different groups. This is why early testing, access to care, and awareness of symptoms are so important. Previous cancer treatment. People who had radiation treatment near the pelvic area for a previous cancer may have a higher risk of developing bladder cancer later. Stages of bladder cancer. Bladder cancer stages describe how far the cancer has grown or spread. In early stage or non-muscle invasive bladder cancer, the tumor is usually limited to the inner lining of the bladder. Invasive. Bladder cancer becomes invasive when it grows into deeper layers of the bladder wall. This can make treatment more complex. Stage 3. At this stage, the cancer may spread through the bladder muscle wall into nearby tissue. It may also spread toward nearby organs. Stage 4. Stage 4 bladder cancer means the cancer has spread further, such as to the pelvic wall, abdominal wall, lymph nodes, or distant organs like the bones, lungs, or liver. Treating bladder cancer. Treatment depends on the type of bladder cancer, the stage, the patient's overall health, and whether the cancer has spread. Common treatments may include surgery, chemotherapy, radiation therapy, immunotherapy, medicines placed directly into the bladder, or a combination of treatments. Who treats bladder cancer? Bladder cancer is usually treated by a medical team. This team may include different specialists who work together to plan care. Clinical oncologist. A clinical oncologist is a cancer specialist who may help with treatments such as chemotherapy or radiation therapy. Pathologist. A pathologist studies tissue samples to help confirm the diagnosis and understand the cancer type. Radiologist. A radiologist reads medical imaging scans that help doctors see where the cancer is and whether it has spread. Help getting through cancer treatment. Cancer treatment can affect physical health, emotional health, family life, and daily routines. Support from loved ones, clear communication with the medical team, and trusted cancer support services can make the journey easier. Survival rates. Survival rates are general statistics based on large groups of people. They cannot predict exactly what will happen to one person. Statistics. Bladder cancer makes up a significant number of cancer diagnoses worldwide. Awareness matters because early symptoms can sometimes be missed. 5-year survival rate. The 5-year survival rate means the percentage of people in research studies who are still alive 5 years after diagnosis. It does not mean a person will only live 5 years. The key message is simple. If you notice blood in your urine, unusual urine color, pelvic pain, back pain, unexplained weight loss, or swelling in your legs or feet, do not ignore it. These symptoms do not always mean bladder cancer, but they should be checked by a qualified healthcare provider. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. If you notice concerning symptoms, please speak with a qualified healthcare provider.